So first of all, it's good to be here today. I'm gonna sort of pitch this at a pretty basic level just to go over sort of the basics about what wastewater is and how we use it and its potential utility in terms of the totality of which we use surveillance and public health. So wastewater-based epidemiology is just really one component of environmental surveillance. Um, I like this picture. This image was created during the early days of the COVID-19 pandemic when wastewater-based epidemiology really started coming into its own. And I'll talk a little bit more about the history. But the idea is that, something that we typically think of as waste and we want to get rid of and we want to treat and reclaim our water has a lot of valuable information in it in terms of tracking what we're exposed to and transmission of disease. So this is sort of the guide for what we're going to go over today. Talk a little bit about what wastewater is and what it means, how that fits into a context of environmental surveillance. And then I'm going to spend some time just, going into the approaches for sample collection, sample analysis, how you set up a framework for doing wastewater-based surveillance for any number of targets. We'll also talk about pros and cons, what it can and can't do. Um, Value in direct detection of pathogens versus sequencing approaches, and then how that fits into the larger framework of other surveillance systems. My ultimate goal here is to sort of set up for the next talks that we're going to have over the next couple of weeks that'll go into more details about how this is actually applied in real world situations. So first we start with what is wastewater. This is one definition from the US Geological Survey. The idea is that wastewater is simply used water. It includes substances, human waste, food scraps, oils, soaps, chemicals. It's the water that basically drains from your sinks, your showers, your bathtubs, your toilets, washing machines, dishwashers. It's everything that goes into that that leaves your house to be treated. It can include residential buildings, businesses, industries. It's all of that used water that must be cleaned. In most cases, that goes to a centralized wastewater treatment plant. Sometimes that goes into individual systems, but we're going to be focused on those larger centralized plants. As I said, we think about wastewater as something we want to treat, we want to clean, we want to be able to reuse it, but there's a lot of information from that raw wastewater as it comes into a plant. So you can kind of think of wastewater as being an information highway. For a long time, it's been used to look at prescription drugs. You can find the metabolites of prescription drugs through wastewater surveillance. This has been heavily used during opioid epidemics to see where there's particular problems on a temporal and spatial scale. You can also use it to look for illicit drugs. Some of this starts bringing into questions about how this can be used ethically and if it gets to too individualized basis, or it can be used collectively to tell you what's going on in a population. Can tell you a little bit about the diet and practices of a population. Things like Splenda, sucralose are not metabolized well, and you can find markers of human use throughout the wastewater system. Again, things like caffeine, you can tell what diet and use over a population. Work has also been done to evaluate, what the health of a city looks like. You can tell a difference in microbiome depending on where you are, what the sewage looks like in a particular area. And it's been used also to look at antimicrobial resistance. Wastewater's long been thought of as a hotspot for antimicrobial resistance exchange and a reservoir because of the high amount of bacterial activity, the high organic matter matrix. But it can also be used to tell us, if we have issues with AMR, if we've got emerging AMR genes in a particular area or population. So there's a lot of things that we can tell from our wastewater, and this is not even getting into infectious diseases. The idea of really using wastewater as a barometer of what's happening within a community really started in the 2000s. 2018, there was a paper that really there was a series of papers that was really looking at uh, pharmaceutical use, illicit compound use, to monitor the health of cities' residents. The idea was look no further than their sewers. You can find information about all the drugs and compounds that they're using just by looking at the intake of a sewer line. Rolf Haldeman quoted, if you're out the mouth of a wastewater treatment plant, you can essentially observe all of the chemistry that's being used in a city. And for a while, there really was a big focus on pharmaceuticals and chemistry. The use of wastewater-based epidemiology, though, as a tool really took off in 2020. And that was not because of its increased use with pharmaceuticals. It was because it became an extremely valuable tool to look at the COVID-19 pandemic. So this was one of the first papers that came out with a really, fantastic list of a lot of people that started doing this work. And it proved to be extremely effective way, especially early on in the pandemic when it was hard to get clinical tests. Wastewater was really, really robust to tracking what was going on with COVID-19. And you can see from these Google Scholar citations, once we get through 2020, 21, it really takes off. And it's gone beyond COVID-19 in terms of how we can use wastewater to look at infectious agents. In fact, our ability to look at infectious agents really in sewage goes far earlier than the work that was being done on opioids and chemicals. If you go back to 1952, Sir Brendan Moore in the UK was using swabs installed in sewer lines to identify households that had active cases of Salmonella typhi and paratyphi. The Moore swab is still used to this day as a passive sample collector in a lot of context. But this was one of the earliest examples of using the fact that we flush waste into a system and that flush waste can tell us something about what's happening in a population. In this case, Moore was using it to try to go up into a sewer shed to understand who might still be transmitting Salmonella typhi. It's also been used more recently, prior to the COVID-19 pandemic, as a way to track efficacy of vaccine campaigns. So using sewage surveillance to see how we were doing in terms of poliovirus detection and whether or not there was breakthroughs in areas where they were still trying to get vaccination campaigns completed. And this was the first work looking at poliovirus detection in sewage was in the 1950s. And then it was really through the 2000s to evaluate the efficacy of vaccine campaigns. So using sewage to understand what's happening with infectious diseases, especially enteric diseases, has been around for a long time. It really just got moved to the forefront with the COVID-19 pandemic. So when we talk about wastewater surveillance, I sort of want to put that into context of how we're using it now. It's just one component of environmental detection. You can use an environmental detection or environmental surveillance in a lot of different ways. There's been work for airborne infectious agents to use air filter media. You can do surface swabs. You can look at sentinel areas. But the idea is you're going out into the environment where you might expect to see these pathogens as a proxy for what's going on in the community. Wastewater surveillance is a very particular type of environmental detection because it really takes advantage of the fact that a community that's on a centralized sewage system is flushing all of their waste into that system. So you can really center this on the idea that that collected sewage provides a pooled sample of an entire population within a catchment area. So that may be hundreds of people, maybe thousands, maybe millions of people, depending on how big the catchment area is. So I mentioned, at the beginning of this, trying to define what wastewater is. And it is, again, it's that flushed excreta, feces, and urine, which we generally refer to as black water in a wastewater system. Water that's rinsed down the drain from sinks or laundry, which is considered gray water. And then saliva, anything else that goes down the drain, including microbes, chemicals, nucleic acids. And all of that's basically captured in the conveyance system as it moves along to the wastewater treatment plant. And I think it's important to note here, we spend a lot of time thinking about the feces and urine because that's where we suspect that a lot of, these organisms are coming from. But it really is, the broad mix that goes into that, what we're washing off of our skin, saliva when we're brushing our teeth, when you're doing laundry. All of that can potentially include infectious agents or nucleic acids that are shed into the system that can then be found downstream. So we can use the untreated wastewater before it goes into the treatment train to screen for pathogens, chemicals, or other markers. We can also look for these things at any point along the conveyance network. And I'll talk a little bit more about, when that might be important to go all the way downstream. So you're catching the entire catchment area, or you want to move back up into into specific regions. So this is the basic, idea of wastewater-based surveillance. You've got any number of things, again, that are washed into our sewage system. It's the prescriptions that we take, it's illicit drugs, maybe it's metabolites of nicotine, alcohol. Tells us a little bit, again, about our health of the population. The microbiome may look different between different types of populations, and then infectious agents. Within the sewage system itself, the catchment will have sewer lines that come from each individual property. So if you live somewhere that's on a sewer system rather than being on a septic tank, you have the line that goes from your house out to the street, which then connects to a larger trunk line and then builds as you go down to the wastewater treatment plant. So you can think of it as analogous to a river system. So you've got all those tributary streams and it's going down into a large main stem of the stream. The same thing is happening with wastewater, it's just happening underground and in pipes. But the idea is, again, you're collecting it from this entire area. So by the time it gets to the wastewater treatment plant, you've accumulated this wastewater information from an entire community. So what wastewater-based surveillance offers is a lot of things that complement what we do with clinical surveillance. First, it's non-invasive. It's also non-treatment seeking. So you do not need to seek out a medical professional if you think you're not feeling well. If you are flushing your toilet or you're rinsing things down the drain, your sample is going into that pooled system. And nothing is required of you. It's just what you do every day. You're contributing to that sample. Unless you're going well up into the catchment area, it also maintains privacy. So you don't need an IRB to do this. You're dealing with thousands of people at once. It's anonymous when it gets to that point. So you're really just looking at a collective view of what's happening in a community. So this means it gives you population level data without having to do extensive clinical testing. Depending on how frequently you're sampling and how quickly you're getting through your processing flow, your data can be reported in near real time. So that ability to give you information quickly, especially in a pandemic or when you've got something new that's happening, is extremely valuable. And it can also give you really helpful spatial and temporal trends. Most of the time when you're setting up a wastewater-based surveillance system, you're sampling, maybe daily, twice a week, weekly. It's really frequent. And the way that wastewater treatment plants are set up, you can have a lot of spatial variability and a lot of spatial scale so that you can really see what's happening across different populations in a pretty quick manner. Now, it doesn't get you to the individual. You can't say X person was sick or needs to be isolated or quarantined. It really is a population level metric. So now I just want to spend most of this talk sort of just giving a background of the steps that go into setting up a wastewater surveillance system and things that you would need to consider. And this is, a very simplified view of what this stream looks like. So you go from the individual shedding. So that's the information that you're ultimately trying to understand is, the individuals within a community who's shedding the particular pathogen of interest. It's going through a sewage conveyance system, and you are taking a sample at any point along that conveyance system, either up closer to the individuals or downstream when you get to the wastewater treatment plant. You have to do your analysis in the lab, detection, and then reporting of what you have. So I'm going to go through sort of 4 general steps on, considerations for when you're setting up your sampling strategy, considerations for how you're processing your sample, and what that means in terms of your target detection, and then analysis and what you do with that information, because ultimately we want this to be relevant for public health action. So starting with sampling strategy. So again, the wastewater surveillance can occur anywhere along the continuum from the building where you may have just a few people to the total sewage catchment area, which depending on your treatment plant may be thousands of people and maybe millions of people. So that's completely within our purview, is to decide what information you need. Most of the time people are hitting the larger catchment area. That information about the whole community is often we've found to be valuable as we've moved through the COVID-19 pandemic. But if you're really, want to understand if there's particular areas that you think are hotspots, then you just move up the conveyance system. But let's talk about what a conveyance system is quickly. So if you haven't, spent a lot of time thinking about wastewater systems, wastewater treatment, This is an easy thing to forget. You know, our wastewater infrastructure is buried underground. We don't see it, we don't think about it unless it's not working and it's not working in a very visible way. But when we talk about a collection system or a wastewater treatment system, it's essentially the system of underground pipes and those maintenance structures that move the wastewater. This has been, you know, we've had sewers for a long time. They go back to Roman times, and the idea is you are moving waste from where people live somewhere else. You know, ideally in modern times, that means we're moving the sewer systems, the conveyance systems are moving it to a treatment system that cleans it up and makes it safe for use once it's discharged. But essentially, that's what a sewer is. It's just moving the wastewater. And we have a lot of sewer lines in the United States. So we have about 500,000 miles of publicly owned sanitary sewer lines and about as many that are privately owned. So we've got close to 1 million miles of sewage running underground just in the United States alone. 75% of wastewater in the United States is disposed of through centralized sewers. So again, when we think about the information potential, that covers a lot of population. It's not everybody, and there are certainly areas, especially in very rural areas, where this becomes more problematic. But over most of the US, this is a really good way to try to understand what's happening with the population. So the conveyance is really the first step in wastewater treatment. That flushing of water or the draining of water into the sewer line is the first step. The waste is collected at that source and then transported to a central location. So when you think of a sewage catchment, it includes all of those conveyance lines that lead to a single treatment plant. And I wanted to really highlight this because it offers opportunities and challenges. It means there's opportunities to sample in a lot of different ways in a lot of different places. In terms of challenges, you really need to know a little bit about how extensive your conveyance lines are because it can affect the viability of some of your pathogens as they're moving through that conveyance system. But if we start from the idea of sampling from a wastewater treatment plant, I sort of wanted to pull this up as another larger view. So we think of wastewater moving from the catchment area. Again, we can start at a most upstream point. This is, you know, our single house, which you would probably rarely ever do, but in theory you could. You could pop a manhole and look specifically for a very small community. As you move downstream, you start collecting from more areas. And then finally, you get to the wastewater treatment plant, which I have outlined here. When you get to this point, typically you are taking samples from raw sewage or some point in that initial primary treatment step. It could be that you're taking the solids that are settled out. So if you might take material from that grit chamber, but generally you're taking material from somewhere past the bar screen. So you're getting rid of really the big particulates, but before it goes into real wastewater treatment. And that's the key thing because you want to get that material before it starts changing too much. And by the time you get into secondary treatment and biological treatment, you're going to have lost a lot of your pathogens and chemicals. So the idea when you're looking at a whole community is you're really getting as close to that source where it comes in as possible. And again, there are pros and cons for what type of sample you may choose to do, and it's going to tell you different information. So if we look at an upstream example, so this is some work that we did in Athens, Clarke County early in the pandemic. So this is just a sub-catchment area. So where I have referred here as WRFA, that's what we're referring to as our Water Reclamation Facility A. So in this case, we were going through and we wanted to get an idea of what was happening in very particular areas. So the lines that you see in red, those were the catchment areas, the conveyance lines that we were able to sample at each point. So in A, that was a very small area. Then we were able to move to B, which is catching a larger portion of the catchment. And then C, we're moving further down as we get closer to the wastewater treatment plant. When you're working in these upstream systems, it's intensive. You don't have a plant operator that is helping you in this case. You are having to go out. Generally, you're working with your public utilities department to understand which manholes are collecting or giving you access to which catchment areas. So you need detailed maps of what's happening in terms of your sewer lines. So again, it feels like you're looking at sort of a river stream map. It's just what's happening underground. Oftentimes when you take these samples, it's a grab sample. So you would go in with a pole and a sterile bottle and collect a sample as it's moving through the pipe under the manhole. That has some disadvantages because it's just one point in time. And we know that how people use water is not the same all day, every day. We generally have times of high use. That tends to be in the morning and the evening. So when you're collecting a grab sample, it may or may not be representative of what's happening. So the other things we can do is we go back to Sir Brendan Moore and we can use a Moore swab, some variety of it where that passive sampler can go into the manhole and stay there for some period of time and essentially can collect waste and material or contaminants that can then be pulled up later. It's not particularly quantitative, but it gives you a good qualitative estimate of what's happening over a period of time. More typically, we're going all the way downstream. So this is that same water reclamation facility A, but now where the point is where the entire catchment, so that all of that purple area is the many, many, many miles of line that's feeding into that particular reclamation facility. Then we have two more, the reclamation facility B and reclamation facility C. So this is the sewage catchment area for Athens, Georgia. And in this case, the sample is coming into a full-scale advanced wastewater treatment plant, which means that we're not popping manholes when you're getting this type of catchment area. Each of these catchments are going to account for, in this case, 30,000 to close to 60,000 residents. So it's a much different scale. You're also able to work with the treatment plant operators. So they have to collect samples all the time as part of their compliance for being permitted dischargers. So it's very easy to, at least in Athens, it was very easy to work with our treatment plant operators. We would tell them that we would need a sample on these days of the week. They would take a subsample from the work that they were doing anyway and provide it to us. Typically, the way samples are handled when you get to the full reclamation facilities or the wastewater treatment plants, it can be a grab sample, just like we can do a grab sample with under a manhole in a sewer line. But more often, you're going to get a composite sample. And typically, it's a time composite sample. So you would get 1 liter sample that's been that represents essentially a 24-hour period. So the sampler takes a little bit every few minutes, and what you end up with is a composite over a full day. And that means that you can quantify a little bit easier what's happening in these areas because you can basically look for a daily load of your pathogen or target of interest. So there's some things to think about when you're considering how you're going to sample for a wastewater treatment plant or a wastewater treatment surveillance or wastewater surveillance system. So if you're upstream, the advantages are you're closer to the source. That could also be a disadvantage depending on what you're trying to do. It also means there's less anonymity. So if you get real close to like a single building, that becomes a problem. You can't get so close that you can identify the sample, where you're getting the sample from. You have to work in a manhole, which makes things a little bit challenging, and you've got to have a good understanding of what's happening in that catchment area. Your sampling options when you're at this stage are to take single grab samples, to use passive samplers like those Moore swabs, or if you're able to, you can set up expensive automated samplers to take composite samples like you would at a wastewater treatment plant. These can be adjusted for time or flow rate, but it's a $10,000 piece of equipment that needs to get set up in and around a manhole. You can collect samples as often as you need. Again, that's one of the really nice parts about wastewater surveillance is, you're limited by what your capacity is and not by waiting for somebody to be sick or give you a sample. When you go downstream to the level of the entire catchment, again, you're capturing, thousands to millions of people if you're in a really big system. It makes it completely anonymous. There's no way to identify any one particular person or group. You have the advantage of being able to work with really knowledgeable treatment plant operators that can, they can help get the sample. They can give you information and metadata about what's happening at the plant at the time. You have similar sampling options. You can take that single grab sample. Often you're taking a composite sample, which is really valuable. You can also don't necessarily have to take the wastewater liquid. There's been a number of labs that have just used the settled solids. So a lot of the pathogens actually fall out with the settled solids, and it can be easier to work with the solids versus the liquid wastewater component. But it follows operator practices, so they're generally not having to do a lot of extra work in order to share the materials with you. And again, generally you can take these as frequently as you need. So the next step, you have your sample, you figured out how you want to collect it, then you move into sample processing. Wastewater is it's very, very high complexity matrix. Your targeted pathogen is likely in very low concentration compared to everything else that's there. So you really have to think about different processing and extraction strategies that you may need. And it may vary depending on if you're just looking for detection or quantification using qPCR or ddPCR versus sequencing what's in that sample. So in terms of initial methods, generally they fall into two categories: concentration dependent processing or direct processing. Concentration dependent processing is based on the idea that you probably need a larger amount of sample that you can concentrate down to increase the likelihood that you're going to find a target of interest. This can include polyethylene glycol precipitation, centrifugal filtration, skim milk flocculation, and then filtering onto HA or electrostatically charged membranes. The idea of the concentration dependent assays, again, is that you can take a large volume down to a small volume to increase your probability of detection. The other option is direct detection. So the proponents of direct detection will tell you that's the case because you lose a lot in that concentration step. Sometimes the efficiency of concentration is not particularly good, and you have a better detection efficiency if you use a direct detection assay. And this can be literally, you just take a subsample in multiple replicates and start doing your DNA and RNA extraction. Or it can be using something like a magnetic bead system like Series Nanotrap offers, which is another mode of concentration, but is a more direct approach. One of the things to consider when you're picking between these two, again, is what you're going to need to do with it. Chances are you can concentrate a lot more down from a very large volume versus using your concentration dependent assays. But if you want to quantify, you may end up losing a lot in that quantification step. Your direct extraction steps may have better efficiency, but it still may be hard to detect things that are in very, very low concentrations. So again, what you end up using may depend on the target that you're interested in. So when you think about your sample processing considerations, we come back to time and resources. Concentration dependent methods can also be time intensive. I know for our lab, when we were doing this heavily during the COVID-19 pandemic, we started out with a concentration-based method and just realized with our workflow that we had better efficiency and much better time management doing a direct extraction approach. But recovery and efficiency are also really critical. And again, that's going to vary by target and the concentration that's actually in your sample. So while concentration dependent methods may not have the highest percent recovery and can affect quantification, sometimes you may need to do it anyway just to find a very, very low abundance target. And finally, the quality of your extracted nucleic acids. This really comes into efficiency versus quality of for nucleic acids for sequencing. Sometimes you can use a pretty basic approach that gets you where you need to go in terms of finding things by qPCR or ddPCR because you're looking for those really tiny fragments. If you're trying to use these for sequencing, though, you have to be a little bit more careful to not shred up your nucleic acids too much. And so that comes to bear as well. So, and we again have found that in our lab that we can do really well with one method for detecting something with qPCR that does not pan out so well when we start to do sequencing. So you have to balance your needs at this point. The third component is target detection. We know that wastewater accumulates a wide range of pathogens. I think this is one of the surprising things about the finding of SARS-CoV-2 in wastewater. We've known for a long time that you can find enteric pathogens in wastewater readily. That's the poliovirus, salmonella, many other things. The fact that we could so easily find respiratory viruses, I think, was a surprise to a lot of people. And now, as this field has grown, we can realize it's not just SARS-CoV-2. We can find a number of respiratory viruses. We can find any number of enteric pathogens. We can even find some arboviruses and parasites. So it's really panning out to be a much more, a much broader approach than I think anybody originally realized. Once you've decided on what you're looking for, you can use a targeted detection approach. So this may be qPCR or RT-qPCR or ddPCR. You may do targeted sequencing, which was the case for SARS-CoV-2, where many groups were and are doing variant detection. It can also be used for more agnostic detection, where you really just get into the metagenome to try to understand everything that might be there, which is going to give you less valuable information in terms of trying to find trends in a particular pathogen, but can give you more information in terms of discovery and new things that may pop up. So when we think about our target considerations, again, if you're doing quantification, which again is typically with RT, qPCR or qPCR and ddPCR, there are assays that are already available for any number of things. These are being used already on dashboards: SARS-CoV-2, influenza A, highly pathogenic avian influenza, norovirus, mpox, respiratory syncytial virus, enterovirus D68, measles, etc. These have already been applied and are working well to track trends across broad spatial areas. The trend analysis is really valuable for this. You can look at what's happening daily, weekly, longer to get an idea of, when you're in potentially times of spike or an increased risk. Data can be shared as raw concentrations, as daily loads, especially if you're getting a time composite sample. And more oftenly, these numbers are normalized to an intrinsic marker. So when you're doing this type of work, oftentimes there's confounders because we know that sewer lines are leaky. So if it rains, you'll have inflow and infiltration which can dilute your signal. So one of the ways of dealing with that is to normalize your qPCR or ddPCR counts to a population-based marker that should be there at relatively similar concentrations. One that's typically used is the pepper-mild mottle virus. So this is an RNA virus that infects peppers and is one of the most commonly found viruses in human wastewater. So it passes through our system. It's just part of what we eat. It's very common, but it has been robust as an intrinsic marker for human population. So a lot of times when we see these dashboards and trackers, it's unitless information, but it's easy to see the trends in terms of what's going on. For targeted sequencing, again, one of the most common places this has been the variant analysis for SARS-CoV-2. So as the pandemic went on, we're not just looking at the virus being there, we're able to actually detect variants as they were moving through populations. And then agnostic sequencing, this is really getting to metagenomes. Again, this is more of an emphasis on discovery, new things that might be there. And this is really where sample quality is extremely important. And you may need to add things like baits to increase probability of detection of particular groups. There may be panels that hit a broad panel of respiratory viruses if that's what you're interested in, or AMR targets. So I think agnostic sequencing is a really important component of wastewater-based surveillance, but it is probably the trickiest in terms of getting good sample quality to do it well. Finally, we're at analysis and action. So you've set up a sampling process, you're analyzing your samples, you're getting information, and then it's what do you do with that information? So dashboards have become a really important tool for displaying semi-real-time trends, especially with SARS-CoV-2, but now expanding into several other things. We can use wastewater-based data to model cases. Again, this is becoming important for COVID-19 as clinical testing has really waned. Wastewater has really become one of the main ways to see what's going on in terms of spikes and transmission. Can use it to track variants, and again, use it for discovery. So this was pulled a little while ago, but this is a dashboard of dashboards. This is a especially for SARS-CoV-2 and COVID-19, the use of dashboards for displaying data was not just happening in the United States. It was really global. And again, this is, as it became more apparent that this was a tool that was really helpful to track what was going on with the pandemic, it really did spread, globally. These are collaborative groups. People generally are very open to exchange information about how to get these things working well. And the data is transparent on these dashboards. This is the CDC National Wastewater Surveillance System dashboard. I just pulled this particular chart. This is for the week ending September 6th, 2025. And this has evolved over time as they've figured out ways to portray data in a way that the general public can use it. So you can see, depending on the height of the line, it may fall into a very low risk category or a very high category. Each of the lines displays a general region. So you can go to the National Wastewater Surveillance System at the CDC and get an idea on a regional basis what's happening in terms of SARS-CoV-2. I mentioned it can also be used for modeling purposes. This was a paper that one of my students, who will be speaking in a couple of weeks, worked on to basically, show that wastewater, which is wastewater-based models, are extremely accurate in predicting cases. So this was based on Athens-Clarke County data. The blue lines indicate the observed levels based on clinical surveillance. The orange lines indicate what was predicted based on wastewater-based data, whether it's detection frequency or daily load. And you can see that over a variety of models, it pans out really well. And this is not unique to Athens-Clarke County, especially with COVID-19. The wastewater-based metrics have been really effective at indicating what's happening in terms of local cases. So as it's not shown here, but as clinical reporting went away, we can still see spikes and trends in wastewater that we feel pretty confident indicate what's happening in the community. So it really has become a primary source of data. And again, we can also do sequencing-based data to look at SARS-CoV-2 variants. So this is again for Athens-Clarke County. This is work that was done by Gabby Witzel and Mandy Sullivan. That showed basically the transition from the Delta wave to the Omicron wave over time in Athens-Clarke County. So what we're looking at here is relative abundance. So it's not giving you a count, but it's giving you an idea of how common one variant is versus another. So again, another tool that we can use to understand what's happening with this particular infectious disease trend analysis. So to start to pull this together, we have a I think an important role for wastewater-based epidemiology, but we have to think about when it makes sense. So when it makes sense to do this is, and the value that it has is that it can assess trends in an entire community at one time. Again, it pools thousands of people at once. It can be important when there's asymptomatic spread of a particular pathogen, if that's important in transmission. It can become valuable when mass and repeated testing is not feasible, or people just don't get tested for a particular disease. And it really complements traditional surveillance and diagnostic testing. And I'll go into that a little bit more in a couple of slides. It can also be used to note emergence. So a lot of the wastewater signal, you will see things in wastewater before you start seeing clinical reports and case reports. So it can give you an idea of what's going to happen, a little bit of an early warning system. It can also be used to monitor the effectiveness of interventions. For those things that are more vaccine preventable, you can get an idea of how well that's working. And that goes to the poliovirus example. One of the important things is, again, everybody who's flushing or contributing to that wastewater treatment system is giving a sample. So it's not biased by testing or test-seeking behavior. And this was work that was done by the Water Research Foundation early in the pandemic, just to give an idea of when you would use this type of sampling. So if you are early, you're looking for an emerging thing, or you think that a wave of a particular infectious disease is coming, you could look at sentinel sites. But the idea here is you would want to be able to be doing enough sampling that you're able to catch a trend when it increases. When you're in the middle of an event, the quantification is important. So early in the event, you just want to know that it's there. When you're in the middle of event, the middle of an epidemic, being able to quantify like how large it is becomes important. Um, Late in the event, again, as you're watching it decline, detection becomes important because at some point you just want to know that it's going away. So again, sentinel sites could be important. You want to monitor well past the last incident of detection. So this model is based on something that is like not become endemic, that it is, has entered a population and is leaving. But I wanted to wrap this into how we think of general public health surveillance and the value of incorporating wastewater into that. So if we go back to a very traditional definition of public health surveillance as the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice. So how do we use environmental testing to support improved surveillance for public health? And the idea is, again, we can detect nucleic acids, we can detect organisms directly in a variety of environments, water environments, the built environment, things that people are touching, and then wastewater is one way to pull it all into one place. So I wanted to sort of put these two things side by side. If we think of, two important areas of surveillance, typical clinical surveillance, passive surveillance, and sentinel surveillance, and then how wastewater fits into that. So with passive surveillance, we can think of diseases are reported by the healthcare providers. It's simple, it's inexpensive, patients are coming in, data is shared, but it's limited by incomplete reporting, variability of quality. It depends on who's going to the doctor, how that gets reported. With wastewater surveillance, we can add to that passive surveillance by providing this pooled community sample in this wastewater influent that's happening on a routine basis. Pathogens are screened regularly across broad geographic areas. Again, it's near real time. You don't have to collect a specimen and nobody needs to seek treatment. So we've got passive surveillance to tell us what's happening with clinical cases, wastewater surveillance to sort of give us the background of what's probably happening in the larger community. For sentinel surveillance, where we're trying to capture things that may be emerging, this may be clinical reporting based on a geographic area or a reporting group, maybe active or passive. Wastewater surveillance is also really effective in these situations too. You can focus on smaller communities or sub-watersheds if you think there's an area that may be particularly at risk. Where it's really come into use though is ports of entry. So there's a whole program doing sentinel surveillance on ships and airplanes as they're coming and going, again, because it's able to tell you something about new entrants into an area. Same can be said of animal facilities as well for spillover events. So this is just an example of that. If we use sentinel surveillance, ports of entry, again, ships coming in, lavatory waste from planes, and then areas where you've got animals congregating, maybe wastewater lagoons where you might expect there to be spillover threats. All of these can be really effective to give you a heads up of things that may be coming in to a system. So with an effective surveillance system based on wastewater treatment or wastewater, this goes to the public health action that was recommended by National Academies of Sciences. So it needs to be a flexible approach. The ability to track multiple pathogens simultaneously and pivot quickly to a new threat is really an advantage of this system. As new, this happened, we were well into COVID-19, Mpox became an issue, and it was very quickly ramped up to include Mpox and wastewater surveillance. We're now seeing measles incorporated into wastewater surveillance. So when you've got sequence information that you can quickly convert into a qPCR or ddPCR assay, or what you're looking for in terms of your sequence analysis, it's pretty quick to take that framework that you have set up and add new pathogens to the system. Wastewater systems also tend to be equitable. At least in the areas that are sewered and are on a sewer line, it's not discriminating by where it's collecting from. So you're able to collect across population dynamics. It includes underrepresented communities. There has been efforts to extrapolate what's happening to unsewered communities. There's also efforts to try to look at ways to take advantage of leaky, ineffective septic systems to get to some of those rural communities, but at least in terms of the areas served by sewer, you're able to get broad demographics. It can be integrated into other systems. So between you're coordinating and collaborating across multiple partners. So you're working with the utilities, you're working with laboratories that are doing the work, and then hopefully public health agencies that can take the information, make sense of it, and use it for action. So the idea is you're triangulating data from different surveillance systems. You're using the passive surveillance or active surveillance from typical clinical uses and incorporating that wastewater background. The idea is to ensure effective data interpretation to support public health decision making. Finally, ideally, a wastewater system should be actionable. And by that, it really means how does it inform decision making? So, that idea of triangulating data from different surveillance systems, how can you take information from what you're getting from wastewater surveillance to make timely and responsible decisions about public health information? Fiscally and operationally, it's relatively sustainable. It can take a lot to get these platforms set up and running, but they're pretty efficient compared to trying to take clinical samples from as many people as are represented by a wastewater system. So I wanted to come back to this 1952 paper. We have Brendan Moore again was surveying sewage swab method to identify latent enteric infections in an urban area. Again, the idea was they were going up into the sewer shed to figure out who was shedding Salmonella typhi and paratyphi. But if you go down to the last section of this paper, in 1952, Brendan Moore was talking about how this might be used. So, the main practical use may not be trying to figure out who's shedding salmonella, but it may be the broader investigation of enteric outbreaks that you can't explain by normal methods of epidemiological inquiry. And also talked about the fact that they were already looking for polio in bulk sewage to determine the distribution of infection throughout the population. So in 1952, this work was being talked about, it was being done. It just took, a few years, 75 years, to get to the point where we're actually putting into operation. So wastewater-based testing moving forward, I think it has a tremendous amount of potential. It's a relatively reliable source to understand transmission dynamics without relying solely on clinical testing. It incorporates real-time reporting, which means the public has access to that information as well as public health agencies. It's a robust platform for screening community-level infectious disease. So again, this utility goes well beyond SARS-CoV-2. And just as a plug for the Center for Pathogen Epidemiology, Pathogen Genomics and Epidemiology, this work that's going on with the Center of Excellence, we're exploring areas of expanding this into many other pathogens and many other applications. So with that, I will take questions. I just wanted to give a brief heads up and teaser for what's coming for the rest of this module. So next week we have Adelaide Roger from Wisconsin, who's going to be giving some specific, real world research reports from work that she's been doing. And then on October 3rd, we have two trainees from UGA who are going to give a combined talk on their wastewater time series analysis for enteric pathogens and AMR. And we have Harrison Yu from the Georgia wastewater program. So with that, I am happy to answer questions if anybody has any. We've got at least a few minutes for questions.